Here's another must-know NCLEX question that's crucial because this question has been asked 8 times in the last 5 years on NCLEX exams. January 2019, April 2019, October 2019, March 2020, August 2021, December 2022, May 2023, and September 2024. You're caring for a 35-year-old client with a fractured femur after a motor vehicle accident. Suddenly, the client reports severe chest pain, confusion, and difficulty breathing. You quickly assess and notice tachycardia, low oxygen saturation, and something unique, subconjunctival petechia. Now, here's the NCLEX question. What's your priority action? Let's look at the options one by one. A. Administer prescribed anticoagulants to dissolve the emboli. Sounds logical at first, right? But here's the catch. Anticoagulants are not used to treat fat embolism syndrome. This condition isn't about blood clots, it's about fat globules entering the bloodstream and causing blockages, so this option is incorrect. B. Elevate the affected extremity to reduce swelling. Should we elevate the leg? No. In fact, elevating the extremity might worsen the embolization of fat particles. Instead, we focus on immobilizing the limb to prevent further fat particles from dislodging, so this is also incorrect. C. Prepare the client for immediate surgery to stabilize the fracture. Yes, surgery to stabilize the fracture might eventually be necessary, but it's not the nurse's immediate priority. The client's life is at risk now, and our priority is to address the current emergency, fat embolism syndrome. D. Notify the physician immediately for further evaluation and intervention. This is the correct answer. Why? Because we need to promptly alert the physician to begin critical medical interventions. Early recognition and treatment of fat embolism syndrome are key to preventing further complications. Now, let's understand why notifying the physician immediately is the best action. Fat embolism syndrome is a life-threatening condition often seen after long bone fractures like a femur fracture. What happens? Fat globules from the bone marrow enter the bloodstream, travel to the lungs, and cause respiratory distress, confusion, and petechia. What do we know about it? The treatment focuses on supportive care, administering oxygen to address respiratory distress, ensuring hydration to maintain circulation, immobilizing the fracture to prevent further fat embolization. In severe cases, respiratory support like intubation may be needed. Here's a pro tip for your NCLEX exams. When you see symptoms like sudden chest pain, low oxygen levels, confusion, and petechia in a client with a long bone fracture, always think about fat embolism syndrome. Remember, your role as the nurse is to 1. Recognize the symptoms early. 2. Notify the physician immediately for intervention. Let's dive into the next NCLEX question that stands out because this question has been asked 5 times in the last 5 years on NCLEX exams: February 2019, July 2020, November 2021, April 2023, and August 2024. A nurse is educating a client with Buerger's disease. Which lifestyle modification should the nurse prioritize? The options are A. Adopting a high-protein diet. B. Regular aerobic exercise. C. Avoiding cold exposure. D. Smoking cessation. Think about it for a moment. What's the most important change this client needs to make? The correct answer is D. Smoking cessation. Why? Let's break it down. Buerger's disease, also called thromboangiitis obliterans, is a condition where the blood vessels, especially in the hands and feet, become inflamed. This inflammation can block blood flow and cause severe pain, ulcers, and even gangrene. But here's the key. Smoking makes it worse. Nicotine causes vasoconstriction, narrowing the blood vessels even further and reducing blood flow to already compromised areas. That's why stopping smoking is the #1 priority. If the client continues to smoke, the disease will progress and treatment won't be as effective. Now, let's look at the other options. A. Adopting a high-protein diet. While a healthy diet is important for overall well-being, it doesn't directly address the underlying cause or symptoms of Buerger's disease. B. Regular aerobic exercise. Exercise can improve circulation, but it won't stop the disease from progressing if the client continues smoking. C. Avoiding cold exposure. Avoiding the cold can help reduce vasospasms, but it's still not as critical as smoking cessation. So, while A, B, and C may help in the long term, D, smoking cessation, is the game changer. Let's add a few more tips about managing Buerger's disease. 1. Medications. Vasodilators like verapamil or cilostazol can help improve blood flow. 2. Avoiding vasoconstrictors. Clients should avoid anything that worsens blood vessel narrowing, like caffeine or cold environments. 3. Early detection. Clients should report any signs of ulcers or gangrene immediately. As nurses, educating our clients about the why behind these changes is just as important as telling them what to do. Understanding helps them stay motivated. Remember, NCLEX is not just about memorizing facts, it's about critical thinking and understanding priorities. With Buerger's disease, smoking cessation saves limbs and lives. This NCLEX question demands attention, as it's been highly tested. This question has been asked 10 times in the last 5 years on NCLEX exams. January 2019, March 2019, June 2019, September 2019, February 2020, August 2020, December 2021, April 2022, July 2023, and October 2024. Now, we're diving into an important NCLEX topic: preventive care strategies. Understanding primary, secondary, and tertiary prevention is essential for your exam and nursing practice. A nurse is facilitating a public health workshop focused on preventive care strategies. The nurse identifies which of the following interventions as an example of secondary prevention. Options: A. Administering a tuberculin skin test, TST, to detect latent tuberculosis infection. B. Promoting the use of mosquito repellents to prevent malaria. C. Conducting a vaccination campaign for children in underserved areas. D. Providing physical therapy to stroke survivors to improve functional independence. The correct answer is A. Administering a tuberculin skin test, TST, to detect latent tuberculosis infection. Let's break this down. Secondary prevention focuses on identifying diseases in their early stages and intervening to stop progression. Administering a TST helps us detect latent tuberculosis early, preventing it from becoming active. That's why it's secondary prevention. Now, let's review the other options. Option B, using mosquito repellents to prevent malaria. This is primary prevention because it stops the disease from occurring. Option C, vaccination campaigns for children. This is also primary prevention as it prevents diseases like measles and polio. Option D, physical therapy for stroke survivors. This is tertiary prevention, focused on managing an existing condition to improve quality of life. Understanding the difference between these categories will help you answer NCLEX questions with confidence. Here's a quick recap. 1. Primary prevention stops the disease before it starts, like immunizations or mosquito repellents. 2. Secondary prevention detects diseases early, such as screenings like TST or mammograms. 3. Tertiary prevention manages existing conditions like rehab or chronic disease care. Keep these concepts in mind, and you'll tackle these questions easily. Let's explore another critical NCLEX question that has appeared because this question has been asked 2 times in the last 5 years on NCLEX exams. May 2020 and December 2023. A nurse observes that a client frequently uses a dismissive tone during interactions, which triggers frustration in the nurse. What would be the most effective therapeutic response to foster communication and maintain a professional relationship? Your options are: A. When you use that tone, I feel disrespected and frustrated. B. Your tone of voice is unacceptable and makes it hard for me to help you. C. Could you clarify what you're trying to communicate with that tone? D. Why do you speak to me in such a condescending manner? Take a moment to think about it. Which response do you think aligns with therapeutic communication principles? Let's break this down. Remember, therapeutic communication is all about fostering understanding and building a trusting relationship. It's not just what we say, but how we say it. Option A. When you use that tone, I feel disrespected and frustrated. This is the correct answer. Why? It expresses the nurse's feelings honestly and respectfully without blaming the client. It opens the door for dialogue and allows the client to understand how their tone affects the interaction. Option B. Your tone of voice is unacceptable and makes it hard for me to help you. This is incorrect because it comes across as accusatory and critical. It might escalate the tension instead of fostering communication. Option C. Could you clarify what you're trying to communicate with that tone? While seeking clarification is usually a good strategy, here it highlights the client's tone in a way that could be perceived as dismissive or confrontational. Option D. Why do you speak to me in such a condescending manner? Why questions are tricky because they often sound judgmental or accusatory. This could put the client on the defensive and block effective communication. So what's the takeaway here? Effective therapeutic communication focuses on feelings without assigning blame, avoids judgment or accusation, opens the door for mutual understanding and dialogue. As nurses, our goal is to maintain professionalism while building trust with our clients. A response like option A helps you do just that. Moving to a significant NCLEX question you should master. This question has been asked 4 times in the last 5 years on NCLEX exams: March 2019, October 2020, January 2022, and September 2024. The nurse is managing a client with VTE receiving a heparin infusion and warfarin therapy. During a discussion with the charge nurse, which statement by the newly hired nurse demonstrates a need for further education? Your options are: A. The heparin infusion should be stopped once the client's INR reaches 3. B. Protamine sulfate is used to counteract excessive anticoagulation from heparin. C. Signs like sudden hypotension and tachycardia could indicate internal bleeding. D. Both heparin and warfarin therapy heighten the client's risk for bleeding complications. Think about it for a moment. Which option stands out as problematic? The correct answer is A. Let me explain why this is a red flag. The newly hired nurse says the heparin infusion should be stopped once the client's INR reaches 3. That's not quite right. Why? In clinical practice, heparin therapy isn't discontinued immediately once the INR hits 3. Instead, it's continued until the INR is within the therapeutic range, typically 2.0 to 3.0 for 2 consecutive readings, or as per the healthcare provider's orders. Stopping heparin prematurely could leave the client at risk for a thromboembolism because warfarin takes a few days to reach its full effect. Always ensure there's a proper overlap between these 2 medications. Option B states, protamine sulfate is used to counteract excessive anticoagulation from heparin. This is absolutely correct. Protamine sulfate is the antidote for heparin overdose. It's vital to remember this because, as nurses, we must act swiftly in cases of excessive anticoagulation or bleeding complications. Option C mentions signs like sudden hypertension and tachycardia could indicate internal bleeding. This is spot on. Sudden drops in blood pressure and a rapid heart rate are red flags for internal hemorrhage, a severe complication of anticoagulant therapy. Always monitor clients closely for these signs. Finally, option D says, both heparin and warfarin therapy heighten the client's risk for bleeding complications. This is also correct. When clients are on anticoagulants, the risk for bleeding is significantly increased. As nurses, our job is to assess for any signs of bleeding, like bruising, hematuria, or gastrointestinal bleeding, and intervene promptly. Here's an NCLEX question that's proven essential over the years. This question has been asked 7 times in the last 5 years on NCLEX exams: February 2019, July 2019, November 2019, June 2020, September 2021, April 2023, and August 2024. An elderly client expresses to the nurse that she wants to modify the living will she created 2 weeks ago because her family circumstances have changed. What should be the nurse's most appropriate action? Now, here are your answer choices. A. You will need to wait a specific period before making changes to your living will. B. I will assist you by finding someone who can guide you through the process of making changes. C. You can only make changes to your living will with approval from your family. D. It's best to consult your lawyer immediately to ensure the changes are valid. Take a moment to think about this. Which one do you think is correct? All right, let's analyze this step by step. First, let me reveal the correct answer. It's B. I will assist you by finding someone who can guide you through the process of making changes. Let's break down why this is the best choice. As nurses, we are advocates for our patients. This means we're here to ensure they get the right support and resources for their decisions. In this case, the elderly client wants to modify her living will due to changes in her family circumstances. It's not the nurse's role to perform legal tasks, but it is our role to guide her to someone who can help, like a social worker, case manager, or legal professional. Now, why aren't the other options correct? Let's review them one by one. Choice A. You will need to wait a specific period before making changes to your living will. This is incorrect because there's no law or rule that restricts a competent client from modifying their living will at any time. The client has the right to make changes whenever necessary. Choice C. You can only make changes to your living will with approval from your family. This is a common misconception. Living wills are based on the client's autonomy, not their family's approval. Nurses need to respect the client's independence in making these decisions. Choice D. It's best to consult your lawyer immediately to ensure the changes are valid. While consulting a lawyer might be part of the process, it's not the nurse's job to direct clients to legal advice. The nurse's primary role is to ensure the client knows where to get help, hence why B is the most appropriate choice. Here's the key takeaway. As nurses, always prioritize patient autonomy and act as a bridge to the right resources. Our role is to empower clients to make informed decisions about their care and legal documents. And remember, questions like these test your understanding of ethical principles, patient advocacy, and professional boundaries, concepts that are central to nursing practice.
All right. Let's move to the first question. This question has been asked 6 times in the last 5 years. A client receiving morphine for postoperative pain reports relief but is concerned about potential addiction. Which action by the nurse demonstrates appropriate client education? Is it A. Provide a pamphlet about opioid addiction and dismiss further concerns? B. Discuss the risk of addiction in detail and reassure the client that it is uncommon when used as prescribed? C. Document the client's concerns and notify the provider immediately. Or D. Suggest a lower dose to alleviate the client's anxiety about addiction. The correct answer is B. Here's why. Option B is correct. This approach is therapeutic, educates the client, and provides evidence-based reassurance about addiction risks. Option A is incorrect because providing written materials alone is not enough. The client needs active education and reassurance. Option C, while documenting is appropriate, notifying the provider without addressing the client's concerns misses an opportunity for education. Option D is not appropriate because adjusting the dose without consulting the provider or fully addressing the client's concerns is not the right approach. Question 2. Now, let's move to the next question. This question has been asked 3 times in the last 5 years. A client with severe chronic pain from cancer expresses concerns about becoming addicted to prescribed opioids. What is the best nursing response? Would it be A. Addiction is unlikely because you need this medication for your condition? B. Unrelieved pain has greater health risks than addiction in your situation? C. Let's consider alternative therapies to avoid opioid use. Or D. It's important to focus on pain control rather than worrying about addiction. The The correct answer is B. Here's why. Option B is correct. It educates the client about the priority of pain management and explains that the health risks of unrelieved pain outweigh addiction risks in this situation. Option A, while partially correct, lacks detail and fails to address the complexity of pain management in chronic conditions. Option C is incorrect. While alternative therapies may be part of the plan, this response dismisses the potential necessity of opioids. Option D is also incorrect because it dismisses the client's concerns and doesn't provide the education or reassurance they need. Question 3. Moving on to the next question. This question has been asked 6 times in the last 5 years. The nurse is reviewing the medical history of a client who is prescribed Valsartan. Which of the following client conditions would prompt the nurse to question the prescription? Is it A, severe renal impairment, B, hypertension, C, congestive heart failure, or D, diabetes mellitus? The correct answer is A. Here's the explanation. A, severe renal impairment is correct because Valsartan is contraindicated in clients with severe renal impairment. It can worsen kidney function and increase the risk of hyperkalemia. Monitoring renal function is critical. B, hypertension is incorrect because Valsartan is commonly prescribed to reduce blood pressure. C, congestive heart failure is also incorrect. Valsartan is used to reduce cardiac workload and prevent the progression of heart failure. D, diabetes mellitus is incorrect. Valsartan can actually benefit clients with diabetes by slowing the progression of diabetic nephropathy. Question 4. Let's move to the fourth question. This question has been asked 5 times in the last 5 years. The nurse is educating a client prescribed Valsartan. Which of the following statements by the client indicates a need for further teaching? And is it A, I should avoid using salt substitutes while taking this medication? B, this medication may make me feel dizzy when I stand up quickly. C, if I miss a dose, I will double the next dose to catch up. Or D, I will have my blood potassium levels monitored regularly. The correct answer is C. Let me explain. Option C is correct because doubling the dose can lead to serious side effects such as hypotension. The client should take the missed dose as soon as they remember or skip it if it is close to the next dose. Option A is incorrect because salt substitutes often contain potassium, and Valsartan can increase potassium levels, leading to hyperkalemia. This statement shows correct understanding. Option B is also incorrect because Valsartan can cause orthostatic hypotension, especially during the initiation of therapy. This statement is accurate. Option D is incorrect because regular monitoring of potassium levels is essential, as Valsartan can lead to hyperkalemia. Question 5. Next, we have a question that has been asked 9 times in the last 5 years. A nurse is evaluating a client's understanding of potential side effects of Valsartan. Which of the following side effects reported by the client would require immediate intervention? And is it A, dizziness and lightheadedness, B, swelling of the lips and tongue, C, mild fatigue, or D, dry cough? The correct answer is B. Here's why. B, swelling of the lips and tongue, is correct because this may indicate angioedema, a rare but potentially life-threatening reaction to ARBs. Immediate intervention is necessary. A, dizziness and lightheadedness is incorrect because these are common side effects of Valsartan's antihypertensive effect and do not usually require immediate intervention unless severe. C, mild fatigue, is incorrect because fatigue is a possible side effect but is not urgent unless it interferes with daily activities. D, dry cough, is incorrect because dry cough is more commonly associated with ACE inhibitors rather than ARBs like Valsartan. Question 6. All right, let's move on. This question has been asked 10 times in the last 5 years. The nurse is preparing to administer Valsartan to a client. Which laboratory value would require the nurse to hold the medication and notify the provider? Is it A, potassium level of 5.9 mqul, B, blood pressure of 140/90 mmHg, C, creatinine level of 1.1 mg/dl, or D, heart rate of 72 beats per minute? The correct answer is A. Let's break it down. A potassium level of 5.9 mql is correct because Valsartan can cause hyperkalemia. An elevated potassium level like this requires the nurse to hold the medication and notify the provider. B, a blood pressure of 140/90 mmHg is incorrect because this is an indication for Valsartan, as it is used to manage hypertension. C, a creatinine level of 1.1 mg/dL is also incorrect because this value is within the normal range. However, renal function should still be monitored regularly. D, a heart rate of 72 beats per minute is incorrect because this is a normal heart rate and does not contraindicate the administration of Valsartan. Question 7. Next up, this question has been asked 7 times in the last 5 years. A client taking Valsartan reports experiencing muscle weakness and palpitations. Which condition should the nurse suspect? Is it A, hypokalemia, B, hyperkalemia, C, hyponatremia, or D, hypercalcemia? The correct answer is B. Here's why. B, hyperkalemia is correct because Valsartan can cause hyperkalemia by decreasing the excretion of potassium. Muscle weakness and palpitations are key symptoms of elevated potassium levels. A, hypokalemia, is incorrect because Valsartan is more likely to cause hyperkalemia, not hypokalemia. Muscle weakness and palpitations are not typical of hypokalemia in this context. C, hyponatremia, is incorrect because Valsartan does not directly affect sodium levels. Symptoms of hyponatremia typically include confusion and seizures, not muscle weakness. D, hypercalcemia, is incorrect because Valsartan does not typically influence calcium levels. Symptoms of hypercalcemia include nausea, constipation, and confusion. Question 8. Let's move to the next question. This question has been asked 6 times in the last 5 years. A nurse is assessing a child with hemophilia who presents with swelling and limited mobility of the knee joint. Which intervention should the nurse prioritize? Is it A, apply ice packs to the affected area, B, administer the prescribed factor VIII replacement therapy, C, encourage the client to move the joint to reduce stiffness, or D, refer the client to physical therapy? The correct answer is B. Let me explain. B, administering the prescribed factor VIII replacement therapy is correct. This directly addresses the clotting deficiency in hemophilia and is the priority intervention to stop the bleeding. A, applying ice packs to the affected area is incorrect. While ice application can reduce swelling, it doesn't address the underlying cause of joint bleeding. It may be done in conjunction with other treatments, but is not the priority. C, encouraging the client to move the joint to reduce stiffness is incorrect because moving the joint during active bleeding can worsen the condition and increase the risk of further bleeding. D, referring the client to physical therapy is incorrect because physical therapy may be helpful after the acute episode resolves, but it is not appropriate during an active bleeding episode. Question 9. Here's the next one. This question has been asked 5 times in the last 5 years. A nurse is providing discharge education to the parent of a child with hemophilia. Which statement by the parent indicates the need for further teaching? Is it A, I should give my child acetaminophen for pain? B, I'll make sure my child avoids contact sports like football? C, if my child gets a minor cut, I can wait to see if the bleeding stops on its own before seeking help? Or D, I'll make sure my child receives regular factor replacement therapy? The correct answer is C. Here's why. C, if my child gets a minor cut, I can wait to see if the bleeding stops on its own before seeking help, is incorrect because even minor cuts can result in significant blood loss in hemophilia. Prompt evaluation or intervention may be necessary. A, I should give my child acetaminophen for pain is correct because acetaminophen is safe for pain management in hemophilia as it does not affect platelets or bleeding risk like NSAIDs. B, I'll make sure my child avoids contact sports like football is also correct and demonstrates understanding of the need to avoid high-risk activities. D, I'll make sure my child receives regular factor replacement therapy is correct and demonstrates understanding of prophylactic treatment. Question 10. And finally, this question has been asked 5 times in the last 5 years. The nurse is caring for a 14-year-old with hemophilia who is scheduled for a minor surgical procedure. Which preoperative intervention should the nurse anticipate? Is it A. Administering desmopressin, DDAVP, B. Transfusing platelets to the client, C. Administering prophylactic antibiotics, or D. Educating the client about postoperative physical therapy? The correct answer is A. Let's go over the details. A. Administering desmopressin, DDAVP, is correct because desmopressin is often used preoperatively in mild hemophilia A to increase the levels of factor VIII and reduce bleeding risks. B. Transfusing platelets to the client is incorrect because hemophilia involves clotting factor deficiencies, not platelet dysfunction. Platelet transfusion is not indicated. C. Administering prophylactic antibiotics is incorrect because while important in some surgeries to prevent infection, it does not address the specific bleeding risks associated with hemophilia. D. Educating the client about postoperative physical therapy is also incorrect because education is essential but is not the priority preoperative intervention for managing hemophilia during surgery. Let's move to the first question. This question has been asked 5 times in the last 5 years. The nurse is caring for a child with hemophilia who reports severe headache and visual disturbances after a fall. What is the nurse's priority action? Is it A. Administer prescribed acetaminophen for pain relief, B. Notify the healthcare provider immediately, C. Perform a complete neurological assessment, or D. Apply ice to the area of impact? The correct answer is B. Here's why. B. Notifying the healthcare provider immediately is correct. Severe headache and visual disturbances are red flags for intracranial bleeding, which requires urgent medical intervention. A. Administering prescribed acetaminophen is incorrect because pain management doesn't address the potentially life-threatening intracranial hemorrhage. C. Performing a complete neurological assessment, while important, is not the priority. Immediate notification ensures timely treatment. D. Applying ice to the area of impact is incorrect because it does not address the risk of intracranial bleeding. Question 12. Now, let's move to the next question. This question has been asked 8 times in the last 5 years. A nurse is reviewing the lab results of a client with hemophilia. Which finding is most consistent with the diagnosis? Is it A. Increased partial thromboplastin time, PTT, B. Increased platelet count, C. Decreased prothrombin time, PT, or D. Elevated fibrinogen levels? The correct answer is A. Let me explain. A. Increased PTT is correct because hemophilia involves a deficiency in intrinsic clotting factors, leading to a prolonged PTT, which is the hallmark of the condition. B. Increased platelet count is incorrect because platelet levels are typically normal in hemophilia. C. Decreased PT is incorrect as PT evaluates the extrinsic pathway, which is unaffected in hemophilia. D. Elevated fibrinogen levels is incorrect because fibrinogen levels are usually normal in hemophilia. Question 13. Here's the next one. This question has been asked 3 times in the last 5 years. The nurse is teaching a group of adolescents with hemophilia about safe physical activities. Which activity should the nurse recommend? Is it A. Swimming, B. Soccer, C. Basketball, or D. Martial arts? The correct answer is A. Let's go over the details. A. Swimming is correct because it's a low-impact sport that provides exercise without a high risk of trauma or injury, making it ideal for individuals with hemophilia. B. Soccer is incorrect because it's a contact sport with a significant risk of injuries. C. Basketball is incorrect because it still involves physical contact and potential joint injuries. D. Martial arts is incorrect because it often involves high-impact moves and potential trauma. Question 14. Next, we have a question that has been asked 8 times in the last 5 years. The nurse is educating a caregiver about infection prevention for a client with Clostridium difficile. Which of the following statements indicates correct understanding? Is it A. I should wash my hands with soap and water instead of using hand sanitizer after caring for my loved one? B. B. I will clean the surfaces with hydrogen peroxide wipes to kill the spores. C. It's important to wear gloves and a mask when interacting with my loved one to avoid inhaling the bacteria. Or D. The spores can be eliminated using alcohol-based sanitizers on my hands and surfaces. The correct answer is A. Here's why. A is correct because hand washing with soap and water is essential. Alcohol-based hand sanitizers are ineffective against C. difficile spores. B is incorrect because hydrogen peroxide wipes are not the gold standard. Chlorine bleach is required to kill spores. C is incorrect because C. difficile is transmitted via contact, not droplets. So a mask is unnecessary. Gloves are important, but not masks. D is incorrect because alcohol-based sanitizers cannot kill spores. Question 15. Let's move to the next question. This question has been asked 6 times in the last 5 years. Which instruction should the nurse include when teaching a client with Clostridium difficile about preventing reinfection at home? Is it A. Avoid sharing your bathroom with others if possible. B. Disinfect surfaces with a solution of isopropyl alcohol. C. Family members should take probiotics to prevent infection. Or D. Take over-the-counter anti-diarrheal medications for symptom relief. The correct answer is A. Let's break it down. A is correct because using a separate bathroom reduces the risk of spreading spores. B is incorrect because isopropyl alcohol is ineffective against C. difficile spores. A bleach-based solution is required. C is incorrect because probiotics, while helpful for gut flora, are not proven to prevent infection. D is incorrect because anti-diarrheal medications can worsen the condition by retaining toxins in the gut. Question 16. This next question has been asked 10 times in the last 5 years. A client diagnosed with Clostridium difficile asks why bleach is recommended for cleaning. What is the best explanation by the nurse? Is it A. Bleach helps to remove visible dirt more effectively than other cleaners. B. Bleach kills both bacteria and spores of C. difficile, reducing transmission risk. C. Bleach neutralizes toxins produced by the bacteria to prevent complications. Or D. Bleach provides a protective layer on surfaces to prevent bacterial growth. The correct answer is B. Here's why. B is correct because bleach effectively kills both bacteria and spores of C. difficile. A is incorrect because the primary function of bleach is to kill spores, not just remove dirt. C is incorrect because bleach does not neutralize toxins. It eliminates spores to reduce reinfection. D is incorrect because bleach does not create a protective barrier against bacteria. Let's move to the next question. This question has been asked 4 times in the last 5 years. Which of the following practices should the nurse recommend to family members of a client with Clostridium difficile? Is it A. Regular use of alcohol-based hand sanitizers after touching contaminated surfaces? B. Wearing gloves when cleaning and handling soiled linens or clothing? C. Taking prophylactic antibiotics to reduce the risk of infection? Or D. Sterilizing the client's utensils in boiling water after every use? The correct answer is B. Let me explain. B is correct because wearing gloves prevents direct contact with spores on contaminated surfaces or linens, reducing the transmission risk. A is incorrect because alcohol-based hand sanitizers are ineffective against C. difficile spores. Hand washing with soap and water is recommended. C is incorrect because prophylactic antibiotics are not recommended. In fact, unnecessary antibiotic use can contribute to C. difficile infections. D is incorrect because utensils don't require sterilization. Routine washing with soap and hot water is sufficient. Question 18. Next up, this question has been asked 4 times in the last 5 years. The nurse identifies a knowledge gap when a client with Clostridium difficile makes which statement? Is it A. I will wash my hands thoroughly with soap and water before eating or preparing food? B. I should use bleach to disinfect surfaces in my bathroom regularly? C. Using alcohol-based hand sanitizers is just as effective as hand washing? Or D. I will use hot water and bleach to launder my clothes and bedding. The correct answer is C. Here's why. C is incorrect because alcohol-based hand sanitizers are ineffective against spores. This reflects a misunderstanding. A is correct because washing hands thoroughly with soap and water helps reduce the risk of ingesting spores. B is correct because bleach is the most effective agent for killing C, difficile spores on surfaces. D is correct because using hot water and bleach for laundering ensures spores are killed. Question 19. Let's move to the next question. This one has been asked 10 times in the last 5 years. A client experiencing anaphylaxis has received IM epinephrine, but continues to exhibit stridor and wheezing. Which of the following actions should the nurse take next? Is it A. Administer albuterol via nebulizer, B. Prepare for endotracheal intubation, C. Administer intravenous diphenhydramine, or D. Reassess the airway in 30 minutes? The correct answer is B. Let's break it down. B is correct because persistent stridor and wheezing indicate airway compromise. Intubation secures the airway and prevents respiratory arrest. A is incorrect because while albuterol helps with bronchospasm, it is not the priority when there is significant airway obstruction. C is incorrect because diphenhydramine helps mitigate allergic reactions, but does not address acute airway obstruction. D is incorrect because waiting to reassess the airway could delay necessary life-saving intervention. Question 20. And finally, this question has been asked 10 times in the last 5 years. The nurse suspects anaphylactic shock in a client who developed urticaria after receiving antibiotics. Which additional assessment finding most strongly supports this suspicion? Is it A. Hypertension with a rapid pulse, B. Barking cough and swollen lips, C. Peripheral cyanosis and bradypnea, or D. Decreased urine output and flushed skin? The correct answer is B. Here's why. B is correct because swollen lips and a barking cough are hallmark signs of airway edema and bronchospasm, key indicators of anaphylaxis. A is incorrect because hypertension is not associated with anaphylactic shock. Hypotension from vasodilation and fluid shifts is expected. C is incorrect because peripheral cyanosis and bradypnea are late signs of respiratory failure, which should be prevented with early intervention. D is incorrect because while flushed skin and reduced urine output can occur, airway symptoms are more critical and indicative of severe anaphylaxis. All right, let's move to the next question. This question has been asked 8 times in the last 5 years. Which intervention should the nurse prioritize immediately after administering IM epinephrine to a client with anaphylactic shock? Is it A. Apply oxygen via non-rebreather mask, B. Initiate an IV line for fluid resuscitation, C. Place the client in the Trendelenburg position, or D. Administer corticosteroids intravenously? The correct answer is A. Let's break it down. A. Applying oxygen via a non-rebreather mask is correct because oxygen supports respiratory function and addresses hypoxia, which can develop rapidly in anaphylaxis. B. Initiating an IV line for fluid resuscitation is important but secondary to ensuring adequate oxygenation. C. Placing the client in the Trendelenburg position is incorrect as it may impair breathing by pushing abdominal organs against the diaphragm. D. Administering corticosteroids intravenously is incorrect because corticosteroids have a delayed onset and don't address the immediate airway or hemodynamic crisis. Question 22. Let's move to the next question. This one has been asked 8 times in the last 5 years. A client receiving IV antibiotics suddenly reports chest tightness and difficulty breathing. Which of the following actions should the nurse perform first? Is it A. Stop the antibiotic infusion immediately, B. Administer diphenhydramine IV push, C. Call the rapid response team, or D. Assess for peripheral edema and rash? The correct answer is A. Here's why. A. Stopping the antibiotic infusion immediately is correct because this prevents further progression of the allergic reaction by limiting antigen exposure. B. Administering diphenhydramine is important but should follow discontinuation of the offending agent. C. Calling the rapid response team is essential but secondary to stopping the medication. D. Assessing for peripheral edema and rash is not a priority when airway and circulatory status are at risk. Question 23. Next up, this question has been asked 9 times in the last 5 years. A client in anaphylactic shock is receiving fluid resuscitation and repeat doses of IM epinephrine. Which assessment finding indicates that the client is improving? Is it A. Heart rate of 130 BPM, blood pressure 80-40 mmHg? B. Oxygen saturation increases from 88% to 96%. C. Development of new-onset urticaria and flushing. Or D. Diminished wheezing but persistent stridor. The correct answer is B. Let me explain. B. Oxygen saturation increasing from 88% to 96% reflects improved respiratory function and oxygen delivery, suggesting a positive response. A. Persistent hypotension and tachycardia indicate ongoing circulatory compromise. C. New onset urticaria and flushing signals worsening histamine release. D. Diminished wheezing but persistent stridor suggests airway edema and potential deterioration, which must be addressed immediately. Question 24. Let's move to the next question. This question has been asked 6 times in the last 5 years. A client with rhabdomyolysis is receiving aggressive intravenous fluid therapy. Which of the following findings would require immediate intervention by the nurse? Is it A. Serum potassium level of 6.2 mql. B. Urine output of 50 milliliter per hour. C. Serum creatinine of 1.3 mDL. Or D. Calcium level of 9.0 mRDL. The correct answer is A. Here's why. A serum potassium level of 6.2 mql is correct because hyperkalemia is life-threatening and requires immediate intervention to prevent arrhythmias or cardiac arrest. B. A urine output of 50 ml/hour is adequate to promote renal clearance of myoglobin. C. A serum creatinine of 1.3 mg/dL is mildly elevated but not an emergency. D. A calcium level of 9.0 mg/dL is within the normal range. Times in the last 5 years, a nurse is reviewing the arterial blood gas ABG results of a client diagnosed with rhabdomyolysis. Which of the following ABG findings would the nurse expect? Is it A. pH 748, PaCO2 30 nmHg, HCO3 23 MEQL, B. pH 7.29, PaCO2 40 mmHg, HCO3 18 MEQL, C. pH 735, PaCO2 42 mmHg, HCO3 26 MEQL, or D. pH 740, PaCO2 38 mmHg, HCO3 24 MEQL. The correct answer is B. Here's why. B. Metabolic acidosis is expected in rhabdomyolysis due to the accumulation of lactic acid and toxins from muscle breakdown. A. Respiratory alkalosis is not typical in rhabdomyolysis. C and D reflect normal ABG values, which are unlikely in clients with severe rhabdomyolysis. Question 26. Let's move to the next question. This question has been asked 4 times in the last 5 years. A client with severe rhabdomyolysis is exhibiting peaked T waves on ECG. Which of the following medications should the nurse anticipate administering immediately? Is it A. Furosemide, B. Sodium bicarbonate, C. Calcium gluconate, or D. Albuterol? The correct answer is C. Let me explain. C. Calcium gluconate is correct because it stabilizes the cardiac membrane, reducing the risk of arrhythmias caused by hyperkalemia. A. Furosemide is incorrect because it addresses volume overload but does not treat hyperkalemia. B. Sodium bicarbonate is helpful for alkalinizing urine but does not immediately stabilize the myocardium. D. Albuterol helps shift potassium intracellularly but is not as immediate or protective as calcium gluconate. Question 27. Next, this question has been asked 4 times in the last 5 years. Which of the following laboratory results is the most reliable indicator of acute kidney injury, AKI, in a client with rhabdomyolysis? Is it A, elevated creatine kinase, CK, level, B, elevated blood urea nitrogen, BUN, C, decreased urine myoglobin, or D, rising serum creatinine? The correct answer is D. Here's why. D, rising serum creatinine, is correct because it specifically indicates declining kidney function and acute kidney injury. A, elevated CK, reflects muscle damage but does not directly indicate kidney injury. B, elevated BUN, suggests renal impairment but is influenced by other factors like hydration and protein intake. C, decreased urine myoglobin, does not confirm AKI and might only indicate clearance. Question 28. This question has been asked 9 times in the last 5 years. A client with rhabdomyolysis is receiving continuous IV fluids. Which of the following assessments is the best indicator of treatment effectiveness? Is it A, serum sodium level, B, serum calcium level, C, urine output of 200 millimole in 4 hours, or D, muscle strength improvement? The correct answer is C. Let's break it down. C, urine output of 200 milliliters in 4 hours, is correct because adequate urine output indicates effective hydration and renal clearance of myoglobin. A, serum sodium is monitored, but is not the primary indicator of effective treatment. B, serum calcium may fluctuate in rhabdomyolysis, but does not directly reflect renal clearance of myoglobin. D, muscle strength improvement is not an immediate indicator of treatment success. Question 29, 8 times in the last 5 years. The nurse is developing a care plan for a client with newly diagnosed rheumatoid arthritis, RA. Which intervention should take priority in the early stages of the disease? Is it A, encourage bed rest during flare-ups, B, apply ice packs to joints for 20 minutes every hour, C, administer prescribed disease-modifying anti-rheumatic drugs, DMARDs, or D, schedule physical therapy only after joint deformities occur? The correct answer is C. Here's why. C, administering DMARDs, is correct because early treatment slows disease progression, prevents joint damage, and improves long-term outcomes. A, encouraging bed rest during flare-ups is incorrect because prolonged rest can lead to stiffness and muscle atrophy. Clients are encouraged to stay active while pacing themselves. B, applying ice packs every hour is excessive and could impair circulation. Ice is typically recommended for 15-20 minutes every 2-3 hours during acute inflammation. D, scheduling physical therapy only after deformities occur is incorrect. Physical therapy should begin early to maintain mobility and prevent deformities.